Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, first Helicobacter pylori. Helicobacter pylori, the first culture, the first successful culture of Helicobacter pylori is done by Marshall and Warren. Marshall and Warren has done the first culture of Helicobacter pylori, and they named the Helicobacter pylori as Campylobacter pyloridis. Then around 90% of the duodenal ulcers and even 75% of the gastric ulcers are caused by Helicobacter pylori. And Helicobacter pylori is most commonly present in the gastric antrum. Then the Helicobacter pylori can only be present in gastric epithelium. Why? Because the gastric epithelium will express the specific adherent receptors. Because the gastric epithelium expresses the certain adherence receptors, it can only live in gastric epithelium. So, it is also found in heterotopic gastric epithelium also, because heterotopic gastric epithelium is that gastric epithelium which is present in areas other than the stomach. Normally gastric epithelium is present in stomach, but if the gastric epithelium is present in other areas, then we call it as heterotopic gastric epithelium. So heterotopic gastric, it is also present in, or it is also found in heterotopic gastric epithelium, which is present in the proximal esophagus, Barrett's esophagus, or it is present in, number one, it is present in heterotopic epithelium present in the proximal esophagus. It is present in Barrett's esophagus, where there is metaplasia of squamous cells undergo change or metaplastic change into the columnar cells, which is actually a gastric mucosa. So it is also found in esophagus. It is found in gastric metaplasia in duodenum, and even some heterotopic gastric mucosa is also found in Meckel's diverticulum, and it is also found in rectum also. Right? Next. In the Helicobacter pylori, it mainly infects the person in the childhood. So the patient will be infected usually in the childhood, and once the child is infected, the infection is present for life. The infection is present for life, and here in spontaneous remissions are rare in H. pylori infections, because once it gets infected, it is present for life in the patient. Now, infection here is inversely proportional to the socio-economic status. So, it is present, more of the infection is present in lower socio-economic status. Now, if you see the mechanism of ulcer formation by the Helicobacter pylori, actually the Helicobacter pylori will stimulate the gastrin release. It will inhibit the somatostatin. It will stimulate the gastrin release, inhibit the somatostatin release, and it will also interrupt the vagal reflexes. Also, it will stop the vagal reflexes, and it thus inhibits the gastroduodenal bicarbonate secretion, and thus overall it increases the acid relative to the bicarbonate, and thus resulting in ulcer formation. Right. Even after eradication of organism, once you eradicate the organism, then the recurrence of ulcer is rare in Helicobacter pylori. So,
thank you and thank you for watching.